Well, hi everybody, and welcome to BPD Update. My name is Steve Strachan. I'm your Chief of Police for the City of Bremerton, and hopefully you watch our show regularly. And if you do, you might know that we talk a lot about mental health issues and drug dependency issues and housing issues, homelessness issues, and the reason for that is because it is so completely interrelated with what we do in law enforcement. And I say this, it sounds flippant, and I don't mean it to be, but I frequently tell people that if all we had to do was arrest criminals, this job would be pretty easy. That is a relatively small slice of what we do. A lot of what law enforcement is doing and what a lot of individuals are dealing with is issues related to mental illness, drug dependency, homelessness, criminal offenses committed by people involved in all those things. And again, I guess I would look at it as sometimes law enforcement officers are frontline social workers. And the fact is that helping people in crisis is a huge part of what we do. It also is a huge part of what we do in terms of risk and use of force and some of those things that you see on viral videos. And doing it better for us not only is the right thing for people in our community, but it's also a great way for us to reduce uses of force, to reduce negative interactions with the community, and all those things are interrelated. I have mentioned on this show as well in the past that we have analyzed our jail budget the last 2 years. It may surprise you to learn that in the city of Bremerton, a city of about 40,000, a little more than 40,000 people, in the last 2 years we've spent about $1.2 million each year just for misdemeanor jail costs. So in other words, not felonies, but just misdemeanors, just the lower level crimes. We pay for all the jail costs for individuals who are sentenced to serve time in the county jail. And that cost $1.2 million for Bremerton taxpayers the last 2 years, each year. And about half of that is driven by 60 or 70 people, high utilizers of the system. And they are impacting law enforcement in the jail, they're impacting our budget, they're impacting neighborhoods, and they're impacting the fire department, the hospital, a lot of different aspects of our community. And they're causing issues in terms of quality of life. So the reason I mention all this is because all of this matters to all of us. And when you hear about homelessness and housing issues and mental health, everyone can see the problem. The question is, what are we doing about it? Somebody should do something about that. And we're going to talk about that this month, about some really great things that are going on in terms of helping to move the ball forward and helping individuals who are suffering from mental health problems, drug disabilities, homelessness, and all the rest. Long introduction to a very important topic, and we're going to sort of divide our show into two parts. First half, we're going to talk to Robin O'Grady and Cheryl Piercy, who I'll introduce in just a second, to talk about a great program called Kitsap Connect. And we'll talk about what it is, what it's doing, and where we're going in the future. So with that, if I can introduce to my left, Robin O'Grady. She is the program coordinator for Kitsap Connect. Welcome, Robin.
Thank you. Good to be here.
Thanks for being here. And then a little further to my left is Cheryl Piercy. Her title is, she is the Social Service Director for the Salvation Army. Welcome, Cheryl.
Thank you.
And I see Robin and Cheryl frequently, as do many of our officers, because we all work together in, again, trying to do some good things with folks in our community. So if you could, Robin, to start us off, explain just big picture, what is Kitsap Connect? How is it designed? How long has it been around? And how is it being funded?
Okay. So Kitsap Connect originated in July 1 of 2016 and is actually an 18-month demonstration project. And it's a multidisciplinary team in partnership with Kitsap Mental Health, KCR, the Housing Solutions Center, and the Kitsap Public Health District. So we have 2 nurses on staff, we have a mental health professional, and then we have a housing coordinator on our staff. And what we do is we look for the highest utilizers of the costly community systems and provide them with intensive services. And the hope is that we'll get them re-engaged or engaged with Kitsap mental health services or other mental health services, and that we can start decreasing their use of the jail, the emergency department, the mental health inpatient unit, to help begin decreasing the cost of the expensive community services.
Right. And just very briefly, if you can talk a little bit about the mid-tax or mid-funds and how this is being funded?
Sure. This is being funded through a very generous 1/10% grant through Kitsap County. And so the eligibility criteria includes must have a history of mental health disorders and or chemical dependency or both.
Okay. So Cheryl, if you can explain just a little bit about Kitsap Connect is affiliated with and housed in the Salvation Army, and most folks know that the Salvation Army in the city of Bremerton is at 6th and Park, and a big remodeling and an expansion to that building, a beautiful new part of that building as well. And so talk a little bit about what it looked like before Kitsap Connect and what improvements have been made since this program has started out.
A lot of the clients that are referred in have been coming to the Salvation Army for years, and their needs and barriers are so great that there wasn't a real intensive program that could support them through what they needed to stabilize. And for years, it was just year after year, they lived on the streets, they lived in the alleys, and there just wasn't anyone or any program that could really take those challenges and follow through. And since they were eating with us every day, and we have the hygiene center now, it just made sense that the program would be where the clients were, rather than having the clients go to where our program would be. And so having them in our new building with access to all the services and different things, that keeps them, that puts the Kitsap Connect in with the clients so they're trusted faster, because they're kind of part of the whole, like everyone's having meals together. And that's really sped up the connection too.
And I'm assuming, and I don't work I sort of work in the area of social services, but I don't. I'm assuming that particularly and we talk about a challenging group or people with a high need for services. And in a way, we're using euphemisms to describe people who have just very serious issues, and their behavior is really problematic for other people.
Correct.
Which is why we deal with it so frequently. And it's people, running in the street, harassing people, throwing things, all those sort of stereotypical behaviors that you see, and they're alarming to people, and they're frequently criminal. We call it disorderly conduct or malicious mischief or assault, different things. And so it intersects with law enforcement. And I was talking about those jail costs. The fact is that we have treated a lot of these issues with the criminal justice system, which it's not built for, and that this is to get to the root cause. In other words, to stop that we're just turning the crank. Yeah.
Yes, absolutely.
So can you describe, maybe a success story or an example, or somebody that, has become part of this program? How did they get into it? Why? And where are we going with it?
Sure. So clients are referred to us by a myriad of referring agents, including law enforcement, also the emergency department, and our other community social service agencies. And the majority of them have complex, not just mental health and CD issues, but also medical conditions. The average length that they've been on the street is 2.5 years. Average age is 43. I think our youngest is 26, our oldest is 64. And they have lengthy histories of living outside and really functioning in survival mode. And so they don't advocate well for themselves. They've been banned from a lot of the normal routes that people would take to get their needs met. And so what we're able to do is come in alongside them and walk with them, and hopefully help them repair those relationships with, for instance, their primary care physician and some of the other challenges that they've had, so that they can move into a different place. The other issue is really homelessness. The majority of these folks are unhoused, and the Housing Solutions Center has been amazing at helping us find. We've had 9 people housed, and these are long-term folks that have been long-term homelessness. You'd probably know every single one of them if I brought them up. So we've been able to house through the Housing Solutions Center 9 folks permanently, and then we have another 4 who are temporarily housed, moving toward permanent housing. And what's important about that is that it's very difficult to follow through with normal daily living activities when you don't have some place to lay your head at night. And when you add a host of medical complex medical conditions on top of that, it's very difficult for our folks to be able to get to navigate the systems that need to be navigated in order for them to have any quality of life. We have a lot of people in wheelchairs. We have folks that just have, wounds that won't heal, that have been out in the woods for a long time.
Right.
And then when you add the chemical dependency and the mental health on top of that, you can imagine some of the challenges that we've had. What we have seen in terms of success looks very different according to the individual. Less frequent emergency room visits is one of the big ones that we have. Better functioning in daily living as a result of being reconnected with primary care, medication, medical care, that's a big one. And then the other piece also is the folks that are, we've got, the majority of our folks also suffer from mental health disorders, and being able to get them reconnected with mental health services and get them back on their medication, help them get back on their medication, those are things that are really key for our folks. And we've been able to do that for a lot of our folks.
How does this, I'm interested, Cheryl, in how this, with the hygiene center, which is showers and, basically the infrastructure that people need to get back on track a little bit, with the changes at the Salvation Army and with Kitsap Connect there, and I think it's again a great phrase, which you're talking about. Success may look different than it does to other people. Success may simply mean less emergency room visits. We walk before we run. It's not like everything's going to be fixed in a week. These are very, very challenging individuals. What does that looked like to your staff and to the people that use the Salvation Army in terms of some of those folks that have really caused a lot of problems for you?
It's calmed having the challenging folks be able to connect with Robin and build that team. They don't lash out as much in the setting, like they're not as scared, and so they don't scare everyone around them. And getting their meds and getting their medical needs and getting to, access nursing, all of that has really helped them calm down, which calms everybody down.
Mm-hmm. How do you answer people? And I know the subject relatively well, so I get it. But how do you answer people who say, well, gosh, why are we spending money? Why are we spending mid-tax dollars? Why are we spending donated dollars on people who are, committing crimes, causing problems for other people, who are such a problem for everyone else? Are we in effect rewarding bad behavior? And I'm sure you get that question all the time. Now, I understand why in terms of we're spending our money somewhere anyway, but how do you answer that question?
I think, you could go my usual is the compassionate route, because we need to take care of our neighbors and everyone. But as far as money-wise, the cost of these folks going to the ER every month or once a week and or causing issues in court, back and forth to court, all of that adds up to so much money, so much more money than the cost, in general. I can't even, what would the numbers be?
Well, I know an average emergency room visit is $2,400. An average ambulance ride is $800.
Yeah.
Right.
So for us to be able to minimize those.
And you bring up, Cheryl, you bring up a great point, and I talk to people about the fact that, and this is inextricably linked with things like medical insurance. We're having this conversation about ACA versus, maybe changing the health insurance system. Is if you're on the progressive or more liberal end politically, being compassionate and taking care of our fellow human beings is a powerful argument. If you're conservative and you look at it fiscally, we're spending that money. Emergency room visits are devastatingly expensive, and a lot of the individuals that we're talking about, Robin, are there not just once or twice a day, often more than that, every single day. And we're paying for that through our health insurance and through Medicare. And so money's money, services are services, and how do you do it better? And again, no matter what, where you are in the political spectrum, I think it makes common sense as well as compassionate sense. So again, I think it's been a great program so far. Last question I have for you before we break, and then we'll talk about a couple different topics in the second half of the show. Can either of you share with me, and again, success looks different, but maybe describe some of the behaviors of a, obviously we're not going to name names, but somebody that was really, really having a lot of problems, and maybe just some way that they've gotten a little bit on track, and what that means or what that looks like.
Sure. We were introduced to a gentleman who was calling 911 3 or 4 times a day after being released from a skilled nursing facility. And he's an older guy who's not in the best of health. And what happened was he started engaging with our nurses and was able to get reconnected with his primary care doctor. And at the same time, we were able to transition him into a shared living situation that was stable. And he has been to the emergency room twice since then, and that was over a month ago. So he went from calling 911 3 times a day to calling 911 twice a month. And they were, the 2 times that he called were both health-related emergencies, and so they were appropriate, an appropriate use of the services at the time. So that's one example. I could give you so many examples. We have a client. No one was willing to serve him anymore. He's been in a wheelchair for a long time, born with health conditions, open wounds on his feet. Wound care would no longer see him because he was so agitated and just difficult to get along with, and not able to advocate well for himself, who now his wounds are healed. We're looking at a shelter situation for this person, and this is someone who would not speak to us or make eye contact with us in the beginning of our engagement with him, and now we are his biggest cheerleaders, and he's just right there with us. He's doing everything that we've asked him to do. He's moving forward. He has set some personal goals as a result of engaging with our model, and we've seen great success with him.
That's good stuff.
Yeah.
And I was just going to mention, as you're talking about this, I view it in terms of jail costs, emergency room visits, the fire department. I mean, it's easy for us to kind of forget about that, but when the fire department's out there responding to these repeat calls, that means they're not available for other things. We're not available for patrol. We're not available to go to calls. The emergency room is tied up for other things they could be doing, as well as all the things you're doing. So it's a systems approach that I think is really the right way to go. So thank you both, especially Cheryl. As I said, you're not going to be here for the second half of the show. You talk about the compassion that you bring with the Salvation Army. If people are interested in learning more about the Salvation Army, volunteering, I know you're always looking for volunteers. How do they get more information?
We have a website, but we invite everyone to come down and check in at the front desk. Breakfast is at 8, lunch is at noon. Everyone's all invited.
So anyone in the community, if they choose to, they can come to the Salvation Army, check in, and they can, it's...
Everyone can have breakfast. Anyone who wants a meal can come.
But they can also learn more.
Absolutely.
Find out what they can do if they want to become involved.
We have volunteer packets and different levels, and the holidays are coming, so...
Very good.
Absolutely.
Well, thank you again. In the second half of the show, after this quick break, we're going to talk a little bit about housing, because that's a critical part of this issue, and we're going to also talk about mental health and how those things all intersect and how we do that better. So we'll be right back after this. Well, welcome back. We're talking about Kitsap Connect on this month's BPD update. And just to reiterate a little bit about what that is, it is a program funded through the county's mental illness and drug disability tax. And it's aimed at a relatively small number of high utilizers. So the most challenging, chronic, difficult, whatever word you want to use, individuals that we frequently contact and that are frequently going to jail, frequently going to the emergency room and causing a lot of problems in a lot of different communities. And it's to really try to do something about it and to do it in a long-term way. And we've seen some success. In the first half of the show, we talked with Robin O'Grady, who again is the program coordinator for Kitsap Connect. In the second half, I'd like to introduce our 2 guests. First, in the middle here is Jackie Fojtik, who is the Housing Solutions, the manager for the Housing Solutions Center. Welcome, Jackie.
Thank you.
And then at the end of the table, we have Cesa, who actually works for Kitsap Mental Health, and she is a clinical supervisor. Welcome.
Thank you.
So if we could, Jackie, can we start with you? Kitsap Connect is multidisciplinary. It's a lot of different agencies. It's not just one thing. So you work with Kitsap Community Resources, Folks in Bremerton know that that's the big brick building on Wheaton Avenue there. Housing, we keep coming back to housing. How is this relevant to getting really chronically tough individuals who are often causing problems in the community and contacting us? How is housing relevant to that?
So I work with the Housing Solution Center, and the Housing Solution Center is a part of Kitsap Community Resources. We help people that are homeless or at risk of being homeless. And one of our staff members is assigned to Kitsap Connect, which means that they help people that are chronically homeless. These are people that like you said, are the high utilizers, the people that may have been homeless for years and years. They have gone through the system, maybe they've been through all of the shelters, they've been through all of the landlords. They're people that, like I said, are chronically homeless. So this person that works...
If I may, they've sort of, what I'm hearing you say is they've kind of burned all their bridges.
They have burned a lot of bridges, yes. And they know it. I mean, they'll come to the Housing Solution Center and we'll see them, and they are repeat people that come to the Housing Solution Center too, and we try every avenue. We are advocates. We want to see people housed. And a lot of people, will just say, no, we've already tried them, and we'll have them, try different avenues. Maybe they'll go back and they'll go back into treatment, or they'll get a counselor that'll work with them, and we'll try every avenue. But with Kitsap Connect, all of those pieces are in place. There's mental health counselors there, there's the health district is there, and there's a housing piece. They're all together in one place. So now they're working with the right team that can help get them housed, and the housing person is there. And so basically what we do is we work with them and the wraparound services that Kitsap Connect provides. So the housing piece is the piece that will work with the people in the community that have the housing and try to get them to where they need to be as far as housing. Maybe it's getting into a shared living situation. Maybe it's to get into an Oxford house. The best piece that has come out of this, though, is something called Housing First. Housing First was really successful in places like Utah and some of the bigger cities, where they look at housing first and then they go on to work at the mental health piece, and then they work on the chemical dependency piece. And so the idea is to get people into housing first and then work on the other issues. And we've just started that. We've got a couple people already in housing here, thanks to the landlords that we work with. We work with Adrian Properties. Jim Adrian's a great advocate for us and is working with us. We're looking for more landlords that are willing to take, to jump on board and help us out and work with some people, take some chances with us. And so basically we have people that are working with us. We've got them, but it's strong case management, mental health's working with them, wraparound services that make it possible for us to get people housed first and then keep them housed. That's what's important.
So there's an element here where, and I certainly see this from the law enforcement perspective, is a person has an issue and they don't have housing or they're homeless. Now, there's a variety of reasons for that, but when you talk about wraparound services, and I view this as sort of connecting all those dots, so that if you tell a person, well, show up in Port Orchard next Tuesday at 2 o'clock and you'll have an appointment with a counselor to talk about this particular issue, is like asking somebody to go to the moon. I mean,
right.
It's just not going to happen. And so this is about getting all those things connected, sort of a one-stop shop, and somebody needs to, in effect, hold their hands.
Absolutely.
And that, I realize it's easier for people to say, well, they shouldn't have to do that, and nobody did that for me. Again, this is a problematic group of people, and they're costing us a lot of money and a lot of problems, and this is a much more constructive and frankly fiscally prudent way to approach it. Plus, it's the right thing to do for them.
Absolutely.
Is that what I'm hearing you say?
And it's working.
And and I was just going to ask you that. It's working. I mean,
We see it working.
What have you seen so far?
So far, we've seen it working. We've had people that we put into shared living situations where it's been months now and they're working, and Robin cited some figures where we have successfully put people into that. We've just now started the Housing First models with Bremerton Housing Authority and some local landlords, and we're seeing them. We've seen behaviors change. We've seen people showing up for appointments. We've seen just where people are doing the follow through that you wouldn't in the past. They haven't, and now they're motivated to do that.
When you said that, it made me think about our last BPD update. We had our behavioral health specialist, Linda Melseth, who is also mid-funded and is another part of all these different things that are going on to improve the approach to mental illness and drug dependency. And she talked about, she basically rides with our officers and works directly with us and the individuals we contact. And so there's some intersection with, certainly with Kitsap Connect, but she talked about people that we never imagined would be in any way on track. And yet they are, and it's not, again, success is defined differently sometimes, but they're not getting arrested every 3 days, and they're not running into traffic, and they're not assaulting people. And again, just throwing people into jail repeatedly, it's like the drug war. We've been doing this for years. Where are we going with this? And so, we've seen it work with people that, frankly, I didn't think we'd see that see that with.
Like to hear that.
It's a great point. Anna, let me ask this question, kind of the global question. As a clinical supervisor working in the area of mental health, I think we know that mental health has a lot to do with some of these high utilizers and people that are interacting with law enforcement, certainly, and often don't have housing. Mm-hmm. In the big picture, why is that?
Well, I think it's sort of a cyclical thing. I think that some of these individuals have serious mental health concerns that make it harder for them to advocate for themselves to get their needs met the way that might be easier for other people. But then you also have to look at the facts, like you were saying before. If you don't have housing, that's inherently traumatizing. That puts you immediately into crisis mode. And if you're in crisis mode, if you've been through trauma, you can't plan as well. It's much harder to think ahead. It's harder to communicate your needs with other people. Everything just becomes exponentially harder. I mean, we all know this. When we're stressed out, we don't communicate our best, and we aren't at our best selves. And it's true for anybody else. And you can imagine how much more compounded that would be if you've gone through a period of homelessness. I'm
going to ask you one quick question. We're almost out of time. These are all great. What is still missing? If you were the queen of the world, what's still missing that we still need to do and do it better to make the system work even better than it is right now?
I think we need more landlords. We need more people willing to take a chance and work with us in our community. We've got a lot of great partners and a lot of people supporting this program, but we could really use some landlords that are willing to work with us and come on and be partners with us.
Okay.
Can I piggyback on that and just say respite care? Because we have a lot of folks that are really in need of intense medical care, mm-hmm. who are getting out of the hospital after surgeries and wounds healing, who still have nowhere to go. Okay. So an interim place where those folks can heal and be housed.
Okay. Challenging, but something that's still in need out there.
Yep.
Okay, gotcha. If people want to find out more, if they're interested in Kitsap Connect, where can they get information?
They can give us a call at 360-917-0672. That's the Kitsap Connect office. And you're more than welcome to come down anytime, Monday through Friday between 8:30 and 4:30, and we'd be happy to give you a tour and show you what we're doing and tell you more about our great work.
Excellent. And a lot of people don't know that. They can stop by and see it. And it's not just, it's not just something out there. It is a mystery.
Right.
This, again, is people's tax dollars. It's things that affect a lot of people very directly. And it's important stuff. And I don't think the three of you heard enough, but thank you for all you do. It's important work. So thank you for what you do, and thanks for being here today. Thank you. Very, very important topic, and it affects every single one of us. Again, whether you're a taxpayer or resident who might be affected by individuals doing some of these things, and certainly in my world, it's huge. And in my 30 years, I haven't seen more groups working together and doing good things. For all the problems we have, we're doing a lot of good things out there, and this is a great example of that. So I wanted to bring you some of that information. As always, thanks for watching, and we'll see you next time on BPD Update.
You're working for the government. Policeman! That uniform